Bismillahirrahmanirrahim. Hadith of the day, Prophet, peace be upon him, said, there is no hardship which afflicts a Muslim, but the Allah expiates with it some sin of his, even a throne which pricks him. Muslim and Bukhari riwayat. Assalamu alaikum everyone. My name is Dr. Marina Akhtar, PGR Community Medicine. Today my topic of presentation is HIV/AIDS, human immunodeficiency virus. I am presenting this topic under the kind supervision of my professor Dr. Saira Afzal. Learning outlines. Introduction of the topic, epidemiological triad, chain of transmission, level of prevention, and recent advances and MCQs in the end. Learning outcomes. At the end of this presentation, participants will be able to describe the epidemiological triad, prevention, and recent advances of the topic. World AIDS Day. December 1st is the World AIDS Day. Case presentation. 23-year-old male Masood reports experiencing intermittent low-grade fever, night sweats, fatigue for the last 6 months. He has noticed a significant decline in his appetite, resulting in unintentional weight loss of approximately 10 kilograms during this period. He also mentioned occasional diarrhea and oral thrush. He has no significant past medical history for chronic illness or surgeries. He denies any previous hospitalization or blood transfusion. He is married and has 3 children. He admits having multiple sexual partners and occasional unprotected intercourse. He does not use IV drugs or alcohol. He works as a office clerk in a private company in Karachi. He denies any history of travel outside of Pakistan. On physical examination, general emaciated appearance, weak and fatigued. Vital signs, temperature was 100 degree Fahrenheit, pulse was 92, BP was 120/80, respiratory rate was 18 breaths per minute. And oral thresh on the oral threshold also noted. On diagnostic workshop HIV testing, ELISA was positive. CD count was 120 cells per millimeter cube. CBC, normocytic normochromic anemia was present. Chest X-ray was normal. Oral swab culture positive for Candida albicans. Stool examination negative for ova, parasites, and bacterial pathogens. And the diagnosis, he is diagnosed with HIV/AIDS based on clinical presentation, positive HIV serology, low CD4 count, and the presence of opportunistic infections such as oral thrush. Symptoms of HIV infections: severe headache, swollen lymph nodes, ulcers in the mouth, liver enlargement, body rashes, nausea, vomiting, diarrhea, joint pain, and muscle aches. Introduction of the topic. Acquired AIDS, acquired immunodeficiency syndrome, is a chronic, potentially life-threatening condition caused by human immunodeficiency virus HIV. By damaging the immune system, HIV interferes with the body's ability to fight infection and disease. HIV is sexually transmitted infection, STI. HIV and AIDS, WHO organization. Key facts: HIV remains the major global public health issue, having claimed 40 million lives so far, with ongoing transmission in all countries globally, with some countries reporting increasing trends in new infections with previous on declines. There were an estimated 39 million people living with HIV at the end of 2022, two-thirds of whom are in the WHO African region. In 2022, 6,300,000 people died from HIV-related causes and 1.3 million people acquired HIV. There is no cure for HIV infection. However, with access to effective HIV prevention, diagnosis, treatment, and care, including for opportunistic infections, HIV infection has become a manageable chronic health condition, enabling people living with HIV to lead long and healthy lives. WHO, the Global Fund, and UNAID, all having global HIV strategies that are aligned with SDG target 3.3 of ending the HIV epidemic by 2030. By 2025, 95% of all people living with HIV should have diagnosis. 95% those should be taking life-saving antiretroviral treatment, and 95% of people living with HIV on treatment should achieve a suppressed viral load for benefit of the person's health and for reducing onward HIV transmission. In 2022, these percentages were 86%, 89%, 93% respectively. When considering all people living with HIV, 86% knew their status, 76 were receiving antiretroviral therapy, and 71% had suppressed viral loads. Origin of HIV. Scientists identifies a type of chimpanzees in the West Africa as the source of HIV infection in the humans. The earliest known case of infection with HIV-1 in the human was detected in a blood sample collected in 1959 from a man at the Democratic Republic of Congo. HIV epidemics. Low-level HIV epidemic, concentrated HIV epidemics, and generalized HIV epidemics. Different epidemic scenarios. Generalized epidemics are HIV prevalence among general population greater than 1%. In concentrated epidemic, HIV prevalence among the high risk groups greater than 5%, and low level epidemic, HIV prevalence among high risk groups below 5%, and among general population below 1%. Uh, un- UN AIDS Pakistan 2022 fact sheets are HIV/AIDS estimates. Adults and children living with HIV are 270,000, and adults with age 15 to 49 HIV prevalence rate is 0.2 to 0.2, and other statistics are given there. Now coming to the epidemiological triad, these include agent, host, and environment. Agent. Agent is human immunodeficiency virus, retrovirus. This belongs to retrovirus family. Subgroup includes lentivirus. This is RNA virus, replicates in actively dividing T4 lymphocytes. Its unique ability to destroy helper T cells. It mutates rapidly. It rapidly killed by heat, 20% ether, acetone, and alcohol. It is resistant to ionizing agent and UV light. Types of HIV. HIV-1 and HIV-2. HIV-1 is further grouped into Group B, Group O, Group N, Group M. Group M includes um, A, B, C, D, E, F, and these are showing their different variants present in different countries of the world. HIV-2 include Group A to H that are present in Africa, Brazil, Europe, and US. Reservoir of the infection are cases and carriers. Host factors include ages. All ages are susceptible, more common in 20 to 49 years. Gender, both genders are susceptible. High risk group includes IV drug abusers, receiving unsafe injections, blood transfusion, medical procedure that involve unstilled cutting or piercing, male homosexual or and bisexual, heterosexual partners experiencing accidental needle stick injuries, including health workers. These all includes high risk groups. Mode of transmission. Sexual transmission by blood contact, that is highly contagious, and maternal to child transmission. Who can get HIV? HIV can be transmitted through sex without a barrier or condom. It can pass from mother to baby. It can be transmitted by sharing injecting equipment. It also transmitted by contaminated blood transfusion or organ transplantation. It cannot be transmitted through kissing, hugging, sharing food, insect bite, toilet seats, bathing, sneezing and coughing, and sweating. Stages of HIV infection. First stage is acute HIV infection, people having the large amount of HIV in their blood. They are very contagious. Some people having flu-like symptoms. This is body's natural response to infection. But some people may not feel sick right away or at all. If you have flu-like symptoms and think you may have been exposed to HIV, seek medical care. And stage 2 includes chronic HIV infection. This stage is also asymptomatic HIV infection or clinical latency. HIV is still active but reproduce at very low level. People may not have any symptoms or get sick during this phase. Without taking HIV medicine, this period may last a decade or longer, but some may progress faster. People can transmit HIV in this phase. At the end of this phase, the amount of HIV in the blood viral load goes up and CD4 cell count goes down. The person may have symptoms as the virus level increase in the body and the person moves to stage 3. People who take HIV medicine as prescribed may never move to stage 3. And stage 3 is AIDS, acquired immunodeficiency syndrome. The most severe phase of HIV infection. People with AIDS have such badly damaged immune system that they get an increasing number of severe illness called opportunistic infections. People receive an AIDS diagnosis when their CD4 cell count drops below 200 cells per millimeter, or if they develop certain opportunistic infection. People with AIDS can have high viral load and can be very infectious. Without treatment, people with AIDS typically survive about 3 years. Infections common to HIV and includes pneumocystic pneumonia, candida, oral thrush, tuberculosis, cytomegalovirus, and streptococcal meningitis and toxoplasmosis. Cancers common to HIV/AIDS includes lymphoma, Kaposi sarcoma, HPV-related cancers. Other complication includes wasting syndrome, neurological complications, kidney disease, and liver disease. Immunodeficiency virus in UK. To prevent HIV transmission, it is recommended that mother living with HIV not breastfeed their infants. HIV is a virus that attacks the body immune system and spread through the certain body fluids, including breast milk. Perinatal transmission can occur during pregnancy, birth, breastfeeding. Treatment for HIV include antiretroviral therapy. And the best way to prevent transmission of HIV to an infant through breast milk is not to breastfeed. Level of prevention: primary, secondary, and tertiary level. This picture showing the brief description of primary, secondary, and tertiary prevention. We are going to discuss this in detail in next slides. Primary prevention includes preventing HIV infection through safer sex, not sharing needles, abstinence, pre-exposure prophylaxis, and post-exposure prophylaxis. Secondary prevention of HIV means in reducing the risk of giving HIV to other people by maximizing health outcomes of the person living with HIV through antiretroviral treatment to suppress the viral load, and risk screening and reduction method, partner notification, preconception, and perinatal care. Primary prevention includes awareness about the disease, practice safe sex, sterilization of instruments used for cutting and piercing, and no sharing of razors, injection syringes, and toothbrushes, screening HIV in the blood or blood products for transmission. Specific protection includes chemoprophylaxis with antiretroviral therapy, pre-exposure, post-exposure, preventing mother-to-child transmission. Pre-exposure prophylaxis includes the combination of oral drugs that are given, some drugs are given here, can reduce the risk of sexually transmitted HIV infection in the people at very high risk. Pre-exposure prevention prophylaxis prophylaxis can reduce the risk of getting HIV from sex about 99% and from injection drug use by at least 74% according to Centers for Disease Control and Prevention. Your health care provider will prescribe these drugs for HIV prevention only if you don't already have HIV infection. Post-exposure prophylaxis includes first aid care, counseling, risk assessment initiated within 72 hours. Tenofovir plus lamivudine for 28 days follow-up at 3 months with HIV testing. Vertical transmission. HIV can pass to offspring through placenta during the delivery and by breastfeeding 20 to 25% in the absence of interventions. Prevention of vertical transmission includes antiretroviral drugs, elective C-section before onset of labor or rupture of membrane, refraining from breastfeeding. WHO showing this slide showing that WHO recommendation of antiretroviral drugs for treating pregnant women and preventing HIV infection in infants in source limiting setting. These drugs are given in this slide for the prevention of infants from mother that is already infected with HIV infection. Secondary prevention include early diagnosis and prompt treatment. Incubation period include few months to 10 years or even more. Screening tests for AIDS are ELISA, detect antibodies. Sensitivity of this test is 99.9%. And diagnostic tests include Western blot that detect antibody to viral core protein P24 and enveloped glycoprotein GP41, and second test is virus isolation. Treatment for HIV include ART, antiretroviral therapy, no CD4 cut off for starting AIDS treatment. These are treatment option antiretroviral drugs, nucleoside reverse transcriptase inhibitors, NRTIs, non-nucleoside reverse transcriptase inhibitors, NNRTIs, protease inhibitors, PIs, and others are entry inhibitors, CCR5 receptor inhibitors, integrase inhibitors. First line ART for adults, 2 nucleoside reverse transcriptase inhibitors plus 1 nucleoside reverse transcriptase inhibitors or integrate inhibitor. Routine viral load monitoring at 6, 12, and then every 12 months. Treatment failure, 1000 copies of virus per ml after 6 months of treatment initiation. Second line ART for adults includes 2 non-nucleoside reverse transcriptase inhibitors plus protease inhibitors. Tertiary prevention include HIV-related infection, cotrimazole, managing opportunistic infection and cancer related to HIV. Tuberculosis and AIDS, 16 to 27 times more likely to develop active tuberculosis infection. Tuberculin test may be false negative. Problems also exaggerate with drug resistance. Now coming to recent updates. National AIDS Control Program. Current statistics of Pakistan includes NACP has registered 53.718 HIV cases, among them 32,972 are on ART and 51 ART centers till June 2022. 0.21 million estimated people with HIV, 53,718 registered people living with HIV who know their status in 51 ART centers till June 2022, 32,972 in people currently receiving ARV therapy. National AIDS Control Program aims and goals and objective. Their goal is to prevent a generalized epidemic in Pakistan by containing the spread of HIV and AIDS and eliminating the stigma and discrimination against those infected and affected. Objective includes prevention of HIV transmission, safe blood transfusion, reduction of sexually transmitted disease, establishment of surveillance, reduce stigma attached to the disease, training of health staff, research and behavioral studies, development of program management, create an enabling environment, build the right capacity and strengthening the institutional framework. The article is curing or causing HIV/AIDS in the healthcare system of Punjab, Pakistan. Pakistan National AIDS Control Programs has registered 44,000 HIV/AIDS patients to the date, but the actual number of cases has been estimated to be as high as 150 100,000 to 170 100,000. The healthcare system has a very important role to play in this equation and must be reformed to improve the healthcare service in the Pakistan. So the measures should be in the results. Measures should be taken at the service delivery level by checking the unsafe needle practice, unclean surgical procedure, and unregulated and unretained private health workforce, which are dangerous potential route of the transmission of the virus of the general population. Healthcare establishment carry the chances of nosocomial infection, including HIV/AIDS. Poverty, illiteracy, and stigma associated with the disease is compounding the overall situation. Conclusion includes the improved accessibility to to service delivery with a greater focus on prevention would be imperative to address the threat of HIV/AIDS in Pakistan. A health system approach would help to identifying the gap at both strategic and operational level and concurrently find and implement solutions. Second article is implication of COVID-19 in high burden countries of HIV or TB, a systematic review of evidence. The triple burden of COVID-19, tuberculosis, and HIV is one of the major global health challenge of 21st century. The high burden of HIV TB countries, the spread of COVID-19 among the people living with HIV is well found concern. A thorough understanding of HIV, TB, and COVID-19 pandemic is important as three disease interact. In results, the meta-analysis shows strong evidence that current TB exposure was high risk COVID-19 group. Odd ratio was 1.67 with 95% confidence interval 1.06 to 2.65. The pooled of COVID-19 or TB severity rate increased from with 95 confidence interval 1.12 to 18.10. The recovery rate was high among COVID-19 compared to COVID-19 and TB, irrespectively of HIV status, and the mortality was reduced among the non-TB group. Conclusion in summary, TB was risk factor for COVID-19, both the term of severity and mortality, irrespective of HIV status. Now coming to the MCQ session. First MCQ is Bilal, a 35-year-old man, tested positive for HIV using a rapid finger prick test at community health fair. This healthcare provider advised him to undergo the confirmatory test to verify the result. Which test is typically used as a confirmatory test for HIV diagnosis? Option A is viral load test. Option B is CD4 cell count test. Option C is PCR test. Option D is Western blot assay. Option E is ELISA test. Answer is option D, Western blot test. That is the confirmatory test. Second MCQ is the HIV epidemic in Pakistan is affecting critical communities, including person who inject drugs, men, women, transgender, sex workers. Pakistan is in which stage of AIDS epidemic? Option A is concentrated epidemic. Option B is generalized epidemic. Option C is low level epidemic. Option D is high level epidemic. Option E is epizootic. Answer is option A, concentrated epidemic. There is currently no cure for AIDS. However, drugs are successful in combating HIV and associated consequences. Treatment are intended to minimize the amount of HIV in your body, keep your immune system as healthy as possible, and lessen the number of issues you may develop. Treatment of AIDS is started at the CD4 count Option A 200, option B 500, option C 900, option D 400, option E no cutoff. Answer is no cutoff value is required for the AIDS treatment. Aisha is pregnant and has recently been diagnosed with HIV. She wants to reduce the risk of transmitting the virus to her baby during childbirth. What is the most effective What is the most effective method for preventing mother to child transmission of HIV? Option A breastfeeding exclusively for first 6 months. Option B is taking herbal supplement during pregnancy. Option C is avoiding antiretroviral therapy to prevent side effects. Option D is opting for C-section delivery. Option E is praying for protection from HIV transmission. Answer is option D, opting for C-section delivery. Fatma, a healthcare worker, accidentally get pricked with a needle that was used on an HIV positive patient. What is the most appropriate action for Fatma to take immediately after exposure? Option A is take a prophylactic dose of antiretroviral medication. Option B, wash the area with soap and water. Option C is get tested for HIV after a week. Option D is apply an antiseptic cream to the wound. Option E is ignore the incident as it is unlikely to result HIV transmission. Option A, take a prophylactic dose for antiretroviral medication. Transmission of HIV/AIDS refer to the transfer of HIV from person to person. HIV can only be acquired or transmitted through specified activities such as option A, breathing in an infected droplets. Option B is by mosquito, ticks, and other insect bites. Option C is shaking hands. Option D is sharing cloths. Option E is sharing needles. Answer is option E, sharing needles. Asma, a 40 years old woman living with HIV for past 10 years, present the clinic with the persistent cough, fever, weight loss. On examination. She has reduced breath sounds on the right side of her chest. What is the most likely complication of asthma is experiencing? Option A, tuberculosis infection. Option B, pneumonia caused by bacterial pathogens. Option C, lung cancer. Option D, chronic obstructive pulmonary disease. Option E, asthma exacerbation. Answer is option A, tuberculosis. If left untreated, HIV usually progress to AIDS in 8 to 10 years. When any person gets AIDS, immune system is severely compromised. Person has AIDS when which of these counts occur? CD4 count is lower than 200, CD4 count is lower than 400, CD4 count lower than 500. Option D is CD4 count lower than 600. Option E, CD4 count lower than 300. Answer is option A, CD4 count lower than 200. Zainab, a 28 years old woman living with HIV, present with complaint of persistent diarrhea, abdominal pain, weight loss. Stool examination reveal the presence of acid fast bacilli. What is the most likely complication Zainab is experiencing? Option A, inflammatory bowel disease. Option B is irritable bowel syndrome. Option C is gastroenteritis caused by viral pathogens. Option D is cryptosporidiosis. Option E is diverticulitis. Answer is option D, cryptosporidiosis. MCQ number 10 is an HIV vaccine is a potential vaccination that could be either a preventive or therapeutic vaccine, meaning it could either protect people from getting HIV or treat people who already have it. Currently, there is no vaccine of HIV because of the following: biological, chemical, physical approach to inhibit the virus is more effective strategy. B, latency can be abrogate any vaccination effect. Option C is such vaccination could be too expensive. Option D is virus can be controlled by changing in personal habits. Option E is virus is so antigenically variable. Answer is option E, virus is so antigenically variable, so vaccine cannot be prepared. This is the key of MCQs, and thank you so much.